Around the world, 300,000 women and more than 1 million newborns lose their lives every year from complications of pregnancy and childbirth, often in health facilities that don't have electricity. Turns out that 59% of health facilities in low and middle income countries are without reliable electricity or have no electricity whatsoever. So midwives and doctors struggle to save lives in near darkness. And We Care Solar is bringing solar electricity to health facilities in need to help health workers have the power to save lives and women and children to have safe childbirth. Yeah, I've had a number of different chapters in my life. I originally thought I was going to be a concert pianist and dancer in college, and then I had a medical condition that required me to have surgery, and that got me very interested in women's health care. So I became a pre-med student and ended up becoming a doctor. So for years, I was an obstetrician gynecologist, and I loved my job. I loved delivering babies. And then when I was about 40, I had a devastating setback. I had a back injury that literally put an end to my clinical career. I had to stop delivering babies, stop doing surgeries, and for about a year, get physical rehabilitation so that I could even sit up for extended periods of time. After a year, I was told I wouldn't be able to be a clinician anymore. So I turned my attention to public health. I went to graduate school in public health, first getting my master's in maternal child health and then entering a PhD program. And while I was there, I was invited to join a research project in northern Nigeria that was studying why so many women die in childbirth. At that time, about 500,000 women died every single year from complications of pregnancy and childbirth, which was so different than my own experience as an obstetrician, where I saw pregnancy and childbirth as a really joyous event. So I joined this research project in northern Nigeria where I did medical anthropology. I basically sat myself in a hospital watching doctors and nurses as they conducted care to try and understand some of the factors contributing to these terrible loss of life. So I started writing home to people about the conditions that I was seeing, particularly to my husband, Hal Aronson, who's a solar engineer, and he said, look, when you get back, maybe we can come up with a solution. And so when I returned to the States, he developed a solar electric system for the hospital, and over the next year, the maternal deaths dropped by 70%. The solar suitcase is a compact, rugged solar electric system that was designed specifically for maternal health care. It includes medical surgical lights, rechargeable headlamps, medical devices such as a fetal heart rate monitor and an infrared thermometer, as well as 12-volt DC charging for phones and other devices. And we deliver these to remote health centers that may have no electricity or unreliable electricity. And with the solar suitcase, midwives and doctors are able to provide immediate and appropriate medical care. So it enables health workers to have bright light and emergency communications so that no matter where they are, they can provide immediate and appropriate medical care for women in need. What was once viewed as the most devastating setback to my career ended up opening the door to probably even a more exciting career in some ways. And, I loved actually delivering babies. I loved working with patients one-on-one, but now I know I'm touching literally millions of lives through the work of my team and through our organization. And, even though I hadn't ever imagined that I'd have a career like this, I think particularly after 50, it's really wonderful to say, how can I touch the world? There's so many problems in the world that need all sorts of skills and resources in order to solve them. And so in a way, I feel like many different parts of my life brought me to this moment that I'm able to step up and really rise to the challenge of trying to solve a global problem.